Our first speaker is Marah Curtis, Associate Professor at the UW-Madison School of Social Work and a faculty affiliate with UW-Madison's Institute for Research on Poverty. Her research focus is grounded in the understanding that housing is vital for the health and well-being of families, and we're very excited to have her today to lead off the panel. So thanks, Dr. Curtis, and take it away.
Great, thank you so much. So it's my pleasure to be here and to think and chat with all of you about something that I've been thinking about for my entire doctoral and professional career because of the pivotal importance of such. Sam gave me a very specific charge, and it was to think about the research base around different aspects of housing, the housing bundle, and health outcomes, to think about the state in particular and the housing markets, and also to talk a little bit about this community impact grant that I'm a part of. So I shall do those things, Sam. So why do we care so deeply about housing? All of us got up somewhere this morning. We care, every one of us, deeply about who we live with, who we live around, the quality and the stability of that bundle. Housing is not just a box that you live in. It delivers all kinds of other goods with it. It delivers the public services that you have access to. It delivers the neighborhoods and schools which you educate your children in. And you need that bundle and everything attached to it to actualize all the other things that we care about: labor market success, health, and education. Let's see. Here we go. Now, there is a broad base of evidence looking at the relationship between different aspects of housing and different health outcomes. So I'm going to summarize some of that for you. Okay. There is convincing evidence across place and space that suggests that inequalities in both access, the stability of the housing, and the affordability of adequate housing are related to very serious social problems, things like poor health outcomes for both adults and children, and educational outcomes for children, inadequate medical care, hunger, and homelessness. Another thing to know is that housing costs constitute the largest portion of most families' monthly budgets, particularly low-income renters. There's evidence also that the regularity of monthly income, how regular your monthly income stream is, holding your annual amount of income constant, is associated with housing stability for Wisconsin custodial mother families. There's an intuition here that's important. So certainly, of course, there needs to be an overall base of income, but the regularity and the changes in that income over time can be very directly related to how you can, and if you can, maintain stable housing. Because we all plan our housing, right? We know we have monthly bills coming. And if you cannot depend on a regular source of income, you may underinvest. You may choose less good quality housing for a good reason, because you know you can maintain it. And that's particularly the case for families with children, because moving is deeply, deeply stressful. So you could understand how you might make a decision to move into a place at lower cost and perhaps lower quality and less good public goods, because you know you can hold on to it, because the risk of losing it is greater. Now, housing and family life, this is where we do it all. We do family life based on our housing in our communities. We know that modest earning families' lives are challenging in dynamic ways that may impact consistent earnings. There's the nature of work at the low end, the regularity of such, how well that's regulated. We know that there are more health challenges for folks who are lower down on the socioeconomic ladder. And we know that we have had dramatic changes in family form over the past 30 years. So families are more complicated, living in multiple places, right? And so you have to keep all of that in account. That is what's happening in people's private lives while they're navigating a dynamic private housing market. Okay? Here's the other thing to know. We all know this, but it bears remembering. Housing is largely a private market affair. So you meet the private market with your set of conditions, and then you need to find housing within that. So the tighter the market is, the more difficult it is, with the more challenges you have, and the more unstable your income is. So you want to know, how do families fare in housing markets? So I thought I would just talk about some of the things you need to, or one might consider. And that's because housing markets vary so much. That's the one thing neat about being a transplant from other parts of the country. I've lived in New York, I've lived in Boston, I've lived in New Jersey, I've lived in different housing markets. And even within those different states, I could move from one location to the other and face an entirely different housing market, right? So knowing your own districts, your own areas, and the tightness of the market, the type of housing stock you have there is going to be directly related to the kinds of solutions that you find. There isn't going to be a solution that is going to be equally sensible across all geography, except I would add for the part about having stable and consistent income. That's always going to make a difference. Okay? So there are several things I thought we could point out about thinking about the tightness of the housing market for your local areas. You can think about something like the worst case housing needs. HUD puts those out. They do a report every 2 years to Congress, and they look at the tightness of the housing market for unsubsidized renters throughout the nation. Okay? You might look at vacancy rates. Vacancy rates are a nice, relatively handy measure to get a sense of how tight your housing market is locally. You could look at rental indexes that show you the distribution of rents across geography. You could look at the home value index to see how well neighborhoods are doing. Okay? The other thing I think it's important to think about is to think about the nature of your housing stock in your area. Like the age of the stock. Is it pre-1940s? Why that matters is we know that older housing stock houses more environmental bads that are directly associated with health. So you want to know the quality of your housing stock. How old is it? When was it built? Right? Multifamily housing stock, single-family housing stock are things that one might consider. Housing and health interact at the point when families enter this mostly private housing market with a set of personal circumstances. Okay? What is your family size? What kind of housing stock do you need? What are your earnings? Are they consistent? Can you rely on them from month to month? What kind of employment do you need? What kind of transportation do you need? Are you far from transportation? Do you have access to a vehicle? All of these considerations. Do you have school-age children? Do you need to make use of the public goods that are our public schools? Do you have an elderly family member? Right? Okay. What is your family health? So all of those unique aspects of family life come together and meet this market, right? Now, let's look a little bit at the national picture for housing, and then we'll think about how Wisconsin fits in with that. So if we look at the most recent data from HUD between the 2013 and 2015 period, and they've been doing this worst case housing needs. It's not a great name. The report is called the worst case housing needs, and it's been tracking the tightness of the rental housing market for like well over a decade, right? And so you read it every year, those of us who do this. It's never a pretty story. It's always quite depressing because the worst case housing needs have been consistent, affecting millions of Americans over time. So this last bit of data is no different. Worst case housing needs persisted at high levels across all demographic groups, household types, and across all regions. Okay? When we think about these worst case housing needs, they're defined as renters with very low incomes. And low income in this context is generally defined as those at less than or equal to 50% of the area median income. And folks who do not receive any government housing assistance and pay more than half of their income for rent or live in severely inadequate housing conditions. Now, the important thing to note about this is that severely inadequate housing conditions are not the majority of these worst case house needs. It's affordability. So here's a picture. Pictures are indeed worth many words. So it's just a time series looking at data and the growth of how many millions of families experience these worst case housing needs that are primarily driven by affordability, paying more than 50% of their income for housing, which leaves little income for other things, right? And so if you look from 2005 through 2015, you see a growth from 5.99 million up to 8.3 million. Now, I would draw your attention to the fact that if you look during when we had our recession, right, and we look towards our recovery, 2011, 2013, we know that unemployment did not remain high. However, you see that worst case housing needs do not decline significantly. So even with a return to the employment sector and decreases in high unemployment rates, this affordability issue persists. So 8.3 million, this is the most recent data of folks who are experiencing worst case housing needs. So is Wisconsin an exception? No. It is not. National data substantiates affordability for low-income renters as a national problem, and this state is no exception to that trend. So, okay, let's think a little bit about the state as a whole. The vacancy rate for Wisconsin just last year was 4.5. So this is the proportion of the rental inventory, of the total rental inventory, which is vacant and available for rent. Now, these are units at all price points. That's everybody. That's you and me and Oprah and everybody in the housing market together, okay? So if you're thinking about units that are affordable and available to folks lower down on the income distribution, there would be less units available than for those with more modest incomes, like the story that you started with, yeah? Now, here's another way. Let's think about rental costs. I just picked some areas. This is the Zillow Rent Index. And so what these numbers represent are midpoint estimates of rent in an area. And I'm glad to know that they seem pretty good, because the Milwaukee Metro rent midpoint at $1,364, and that's the midpoint. That means that 50% of them are above that, and 50% of them are below that, right? And Madison, it's about $1,400, and Fitchburg about $1,600, and Portage about $1,000. So you know what the incomes are of the working folks in your various regions, and whether or not this would be affordable for them. This gives you a sense of the diversion in the affordability of housing in the rental market for folks. Okay, so a little bit about the research base, what we know, and it's intuitive. You all know this in your own lives, that income is a key factor for determining both the frequency and the types of moves that households make. Not all moves are bad, some are awesome. You're moving, you're coupling, you're marrying, you're doing something great. You're getting a better job, right? So you can't just look at moves and say, oh, all moves are bad, some moves are good. So you have to have a way to distinguish whether or not the moves you're observing are problematic, okay? We know that folks lower down on the income distribution are less likely to move for upwardly mobile reasons. They're more likely to move because of job losses, family dissolution, okay, or to find lower cost housing. Okay? We also know that adequate household income and income growth are associated with moves to higher cost and quality, right? So there are levers in there. Now let's think a little about the implications of instability for families. Some research that I've done using Wisconsin data, looking at custodial mother families, using data at the zip code level, revealed a level of moving among custodial mother families with school-age children that I was quite shocked by, that the national data can't show us because it doesn't collect that. And you have to think, folks who are mobile, you're not going to capture in surveys because they're moving. So when you go back to capture them again, you can't get them. So the zip code data that we used at IRP enabled us to see short-term moves, particularly for low-income renter custodial families. And there is an amazing amount of moving at the low end that we don't actually know and we don't actually capture. The moving might be right next door. The moving might be right down the block, but you're still having to move, and it's still disruptive. And we don't capture that in our national data. You need different kinds of data to capture that. So what we know nationally about studies investigating the effects of high residential mobility on child well-being, okay, this is a whole body of research. We know that children in the most mobile households may fare worse than their more stable counterparts, even when controlling for demographic, economic, and child-level covariates that are associated with the likelihood of moving and also their child outcomes, right? So that's important. Even controlling for those things that you know would affect both mobility and child outcomes, maybe parental behavior and other stuff, when you hold those things constant, mobility, high levels of mobility don't return good things to the children in those families. So here's another point that I thought I would offer to you. So we've been talking a little bit about one way, how mobility and how health and the quality of the housing may impact outcomes for children and families. But there's also a growing evidence of there being the opposite pathway. Now, we've all heard these anecdotal stories about someone who has a medical problem and financial ruin and they lose their housing. And you wonder, are these anecdotal things actually accurate? Do they bear out? Well, there's a growing body of literature that shocks of that sort, they could be health shocks and other shocks, can indeed be strongly associated, and some might argue causally associated with things like homelessness, right? Okay. So I'm just going to talk about a few studies. Using nationally representative data for cities with populations over 200,000, so you wouldn't want to think about this for cities that are not of that size. These are useful results for similar cities. We find that poor child health increases the likelihood of both overcrowding. Overcrowding is generally thought about in terms of people per bedroom, and homelessness. That may also increase the likelihood of having inadequate utilities and general poor housing quality. Now, the reason why overcrowding matters for children in particular, it's not just the obvious things, that you don't have personal space. It's that you can't control the stimuli. If you don't have a place to study and a place to have your own ability to manage your homework and all of that. So crowding actually really does matter in terms of children's educational outcomes. Now, in a follow-up study, we find that having a child with a severe health condition increases the likelihood that the family experiences homelessness, but this varies by policy mechanisms, okay? It varies by whether those families reside in cities with high fair market rents. Fair market rents are just a measure HUD uses for a rent that's affordable at the low end of the distribution. So in cities with high fair market rents, in states with less generous public assistance, and among individuals who live in poor neighborhoods. So another way of saying that is that you can have a family with exactly the same characteristics in a state or a city with lower fair market rents, with more generous public assistance, and you would not necessarily see the same level of homelessness. Additionally, we find that receipt of housing subsidies, which are quite scarce. Those of us who think about housing know that the availability of housing subsidies, which lessen your rent by about 30% of your monthly income, are very, very scarce. They're a very valuable benefit, but very, very few people get them. Okay? The receipt of housing subsidies, temporary assistance for needy families, the cash portion of that, and SSI, supplemental security income, appear to mediate the effects to some extent. Okay? Okay. Now, I just want to put these few studies in context. Okay? Most families do not have children with a severely limiting health condition. That was not the point of the study. The point of the study was to investigate whether what we call a life shock, an unexpected shock, like having a child with a severely disabling health condition that is not associated with parental behavior. So we're not talking about like fetal alcohol syndrome. That's important because we want to talk about the behavioral aspects, okay? So this health shock is not about parental behavior. It's somewhat random in the population. So then you can not worry so much about parental behavior that affects kids' outcomes and also housing choices, okay? So that's why I did that paper, because the number of people who have children with poor health conditions of this sort are rare, but it gives you some window moving towards causation around thinking about these levers. Okay? So I'm arguing that evidence in this direction suggests that helping families at the low end contend with shocks, financial shocks and health shocks, can increase housing stability. Now let's talk a little bit about the nature of housing. Even though I said earlier that most of the worst case housing needs are driven by affordability, if you look at national numbers, and this is really important, right? If you look at national numbers about our housing stock, you'll find that 95% of our housing stock nationally is awesome. It's high quality. There's very little substandard housing. However, those of you who are working in different communities may see a really high level of that, and that's because those who live in poor housing quality stock are disproportionately in older industrial cities and in places with older housing stock that is also disproportionately inhabited by low-income families and mothers and children, okay? Now, in terms of housing, there are a whole host of studies, I cite some of them for you here, across, within the country and across country that find positive associations between markers of low-quality housing and poor health outcomes. That would be stuff, obvious things, like asbestos, lead paint, rodent, dust mite, cockroach pellets behind the wall, lack of heat and mold. Older housing stock, as I said earlier, is more likely to harbor these environmental bads. And like I said before, though severely inadequate housing is uncommon nationally, low-income households are disproportionately more likely to experience these types of housing problems. And I've come to learn in my work on, that I'll talk about later, that Milwaukee has a good proportion of relatively poor housing stock. So that means it's a great place for me to be doing this research and for you to be doing the work that you're doing. Yeah? Okay. I'm going to talk a little bit about mental health and housing. I've done some work on the other side of it, thinking about health and that impact on housing, and there's evidence that maternal depression, which is relatively random in the population, by that I mean that if you're looking at the entire populations of births and mothers, that it's relatively random who gets maternal depression. Yes, people who have a background of family depression may be more likely, but there's a real strong random component to maternal depression. So it was interesting to get to look at how that might impact housing. Okay, so what we find is that maternal depression during the first postpartum year is a significant risk factor for inadequate child living conditions. Now, all of you who do early childhood development and all of that and know about the research during the first year, how important that is, the things that parents do, in particular mothers do with children, you might think that depression in that first year could be low-hanging fruit and would be particularly important. Okay? So what we find in several studies, under the conditions of stress, families may trade off between food and housing needs while others are driven into situations of multiple hardship simultaneously. So this study suggests that policy domains like health and housing and food security work collaboratively to think about these families, because that will most effectively meet family needs across the different systems, rather than thinking about people. We are not siloed. We're unified beings, as are the families that we work with and represent. So now is the bit where I talk a little bit about the Healthy Housing Initiative, which is a WPP Community Impact Grant. I'm very excited that my community partners are here in the audience today. I didn't know that. Where are you? You're here. Hello. So they're from Community Advocates Public Policy Institute in Milwaukee, Wisconsin. It's been just an incredible pleasure to work with the organization. The other academic partner on the grant is Geoff Swain from the Department of Family Medicine and Community Health, who has expertise in health and community health, and I have expertise in housing and health. And so it's just been a great opportunity to do what I do in a university, but work on the ground. So this Healthy Housing Initiative is a $1 million 5-year grant. The overall project goal is to create conditions for local, state, and federal policymakers to improve current policies that can increase housing affordability, quality, and stability. Notice I don't say housing policies in there, okay? Because it doesn't have to be a policy with housing in the title if you're able to stabilize these other aspects of family life. Okay? The goal of the project ultimately is to improve the health and well-being of low and moderate income Wisconsinites and their families. So the project methods, there are 3 different tiers. We're in the first year now. We're going to conduct a health impact assessment with an organization out of California. And what that will do will allow various actors to understand how their work, domain, and expertise are related to health outcomes. You know, sometimes I talk to folks and they may be working in a particular area and they don't think that their work, because they're working in food security or they're working in another area, they don't think it has anything to do with housing. But anything that can stabilize income or that can meet a need can allow families to negotiate that. And so part of the project goals that I really appreciate is this idea of making things that might not be obvious to folks working in these various systems who might not think they have a lever, but they might have a lever. Okay? So we'll conduct this health impact assessment, and we will create a tenant advocacy council. This is very exciting. Community input, create relationships and collaborations with and by those affected. Because like I said, there's a lot of variation in what's happening on the ground with housing and what families are most concerned about. And it would be wrong-headed to think that a strategy developed in one place might be wholesale useful in another. So you need community input. You need folks who are working on the ground to understand what's the right lever to pull at what time. And then the final pillar is to broadly disseminate the results of this health impact assessment to all stakeholders, to incorporate it into public understanding and into people's ways of working. Again, there may be levers you have at your disposal to pull that are in the best interest of Wisconsin that you didn't even know existed because you hadn't thought about it that way. So that's what's most exciting to me about the project. The other thing that I wanted to say is that the project focuses across the state. So this is a map that I borrowed directly from my partners, looking at the different organizations that we are already partnering with. Again, like I said before, because the housing market is going to vary across space and place, and maybe one area has an issue with quality that is different in tone than another area, you need the community and the tenant advocacy council, as well as these different actors, to help you understand what levers to pull. Now, here's my last few words. In terms of the policy framing, housing and health are a local phenomenon. Okay? Solutions will vary based on the market tightness, the quality and type of stock. Is it mostly single family? Is it mostly multifamily? Is it mostly rental stock? Right? Okay? The population demographics, who are we talking about? And the local and regional stakeholders, even your regulatory stakeholders who are overseeing the quality of housing. So in terms of policy recommendations, I think we can pull from the evidence both nationally and locally, is that stabilizing income stabilizes housing. However, the mechanisms to do that can be varied. And in terms of those of you who are interested in housing construction and maintenance of new units that you might be part of causing to happen, like in your area, housing construction and maintenance, once you get it funded and you figure out how to do that with a low-income housing tax credit or whatever else you do, I know it's a big deal. The trick is always, and this is nationally, how it remains affordable over time to low-income renters when producer incentives expire and when tax benefit incentives expire. It's often lost to the market. And so when you read this literature, it's just a constant concern about the fact that you can create new units, but they don't remain affordable over time. And so the problem doesn't ever get solved. Finally, family health shocks and mental well-being also directly impact housing, those of you who are working in the health domain. So perhaps we might consider on well baby visits, they're all, anyone who has a new kid knows that you spend half your time at doctor's appointments, okay? You're there all the time, right, for your well baby visits. So perhaps including maternal screening for depression during that time period could be useful, asking about housing situations, and if detected, things around depression, a recognition that living conditions may become unstable, and there are serious implications for the children and the family. Families meet housing markets. So policies that strengthen health by recognizing this interdependence, I would argue, are quite primary. Thank you.